to addressing mental health disparities. Today, we will discuss homelessness and mental health, and we have a masterful presentation planned for you. This virtual series is made possible through the generous sponsorship of the National Black Talk Association for Education and Talent Development. My name is Maya Watson, and I bring you greetings on behalf of the Health and Human Rights Institute. I would like to welcome each of you today, and we hope that you are doing well at this time. We want to clarify that the thoughts and ideas expressed today are those of each individual. They do not reflect the views of the National Center for Civil and Human Rights, nor any of its agents, employees, or components. We invite our attendees to ask questions through the Q&A link option on Zoom, and then we will pose those questions to our panelists during our question and answer period at the end of this event. We will be discussing how homelessness can exacerbate mental health issues. To aid us in this discussion, we have a wonderful panel lined up. First, we have KaCey Venning. KaCey is the programs manager for the National Alliance on Mental Illness, or NAMI Georgia. KaCey is a product of a family rooted in living out their purpose. From business and education to the advancement of youth, intellectuals, and ministry, she has always found herself thrust into the middle of helping others sort their stuff out. KaCey holds a Bachelor's of Arts degree in sociology and a Master's of Divinity candidate. She's a Master's of Divinity candidate at the Interdenominational Theological Center. She is the co-founder of Helping Empower Youth and the author of Built for This, A Young Woman's Journey to Self-Discovery and Empowerment and Wrestling with Peace. Welcome, KaCey. Next, we have Afrika Cotton. Afrika is the program manager of the Fulton County Department of Behavioral Health and Developmental Disabilities. She is an experienced clinical social worker with proficiency in anger management, trauma-focused therapy, substance abuse, group therapy, and assessments in an outpatient setting. She is a CBT and DBT trained clinician. As a versatile clinician, she has experience working with children, adolescents, and adults. Welcome, Afrika. I want to thank each of you for joining us today. And Afrika, I have a question. My first question will go to you. When discussing issues like homelessness and mental health, it is often difficult to ascertain which issue came first. Did the mental illness and/or substance abuse precede the homelessness, or did other societal factors like a job loss or divorce lead to loss of a home and introduce mental illness and/or substance abuse? Is determining which issue preceded the other important to analysis and treatment?
So when it comes to homelessness, you can the substance use and the mental illness can cause homelessness, and also the homelessness can exacerbate mental illness. And then the substance use is used as a coping mechanism while dealing with the struggles and obstacles that you have to go through when you are homeless. So both would be the answer to that question. And so when you are addressing the individual, when you're trying to address their mental illness and their homelessness, you would identify, you would address that individual individually. So what works specifically for that individual? And each plan should be individualized, because what may be someone else's path back to stability may not work for someone else. And so you have to meet the client where they are and figure out what does the plan look like that would best serve that person.
Okay, that's understandable. You have to take each individual case individually and assess the needs according to that person.
Yes.
Thank you for that. KaCey, are the tools that are needed to treat members of the homeless population, do mental health professionals who treat that population, do they also feel pressure to ensure that the other essential needs for that person's survival are met? I would imagine that if someone is treating a member of the homeless population, they would also be concerned for other aspects of that person's life and safety, like their shelter. Does that often lead to that mental health professional taking on too much responsibility, and may it lead to burnout?
Absolutely. A good professional is going to be very concerned about what happens when that person leaves that session or leaves their office. Unfortunately, what we're finding that at this time, and hopefully things are changing with bills that are being presented in the Georgia Assembly, is that there's not a coordinated effort for these wraparound services. So a lot of times there's not an easy place for professionals to go to say, hey, my client is suffering or being challenged with finding stable, safe housing, or they're having trouble with their income, and so they can't keep up with the bills and buy groceries. We know that those services are available. The problem is they're not talking to each other. So unless that professional is very well resourced, it's very hard for them to know where to point that person in the right direction to get what they need. And so a lot of the work that we're doing, even with NAMI and with some of the other organizations that I work with, is that we're trying to figure out, how do we coordinate these efforts? How do we know that social workers, licensed clinical social workers, mental health professionals know where to go to get these wraparound services? How do we make sure that we make these wraparound services available to every mental health professional, whether they're in private practice or they're serving the community at large? And so that's the biggest thing. It's not that these resources are not available, it's that I call it the other Atlanta way, which is we're very siloed. We all work in our little pockets and we do great work, right? But we're not doing great work together, and we're not talking to each other about how we can support one another for whatever the reasons. But once that happens, I think it will lift the burden off of some of our professionals to be able to really serve their clients in a more holistic and a more effective way than just handling their biological or chemical or behavioral needs. They can also help make sure that the other areas of their life that are now been impacted by their episode, their diagnoses, what have you, are being taken care of as well. But we have to start with talking to each other and making sure that our mental health professionals know where to get those services.
Awesome. Thank you, KaCey. Afrika, according to a 2014 study, about a third of the homeless have a serious mental illness, and that's usually categorized under schizophrenia or bipolar disorder or severe depression. And that proportion seems to be growing. So can we assume that the remaining 2/3 of the homeless population does not require mental health treatment? Or is it a foregone conclusion that the homeless as a whole are collectively struggling with some level of mental health or substance use disorder?
Yes, I would say as a whole that they're struggling with some level of mental health and or substance use disorder, because being in that sort of situation and not having your basic needs met, you are definitely going to be struggling with some sort of mental health disorder, whether it's anxiety or depression. There are some mental health struggles happening. And so they may not be in what we say our crisis level, or have a severe and persistent mental illness where, with schizophrenia is noticeable. And so people will divert funds and resources there. But when we talk about severe depression, especially when you're dealing with homelessness, with depression, people are like, oh, well, I get sad, so they should be able to, deal with it. It becomes kind of dismissed almost. And that also needs to be addressed as well.
Excellent. KaCey, considering that the Federal Fair Housing Act prohibits discrimination, against a person because of their disability. And that disability discrimination is still the most common type of housing discrimination claim filed with HUD. How can a person with mental illness be expected to successfully navigate housing programs to obtain housing when often these housing programs are complex and competitive, and then on top of that, they may have to deal with discrimination from landlords and other people who are running these housing programs?
Yeah. I hate to say it, but the expectation is for them not to be successful. And what we see is a very kind of unsubtle but subtle way of making sure that they are screening the folks that they want in their communities. Because we know that those who have mental health diagnoses come with a myriad of stigma, a lot of times people don't want to take the time to figure out, well, are you someone who's in a treatment plan, who is stable, who, you know, has your resources and your team together, or are you someone who's recently diagnosed and you're still trying to figure it out, and maybe some of the behaviors that are associated with your diagnoses is going to lend to behaviors that are not becoming of the type of tenant or resident that they want. And so for me, the easiest thing to do, especially when we're talking about places like HUD and agencies that are funding public funded communities, that you should be in touch with organizations like Afrika. The department that Afrika works with, right? So DBHDD, we do a lot of work with them, with NAMI, connecting with social workers, making sure that you have some place where you can say, hey, we have someone who's looking for a place, you know, can you either put them in a plan where you're going to help us monitor what's happening, or do you give them clearance, like, yes, this is their diagnosis, but they're good, they're functional, they're able to take care of themselves. And I think that people are not willing to go the extra step. They're not willing to do that extra thing to make sure that people really are given a fair chance, because what's happening is that it becomes cyclical. So if they don't have a safe place to stay, they're going to find places that are probably going to then encourage a co-occurring disorder. So if they're not already using drugs, if they're moving into areas that are drug infested because that is all they can afford because they don't have substantial income, then it may become, this is an easy way to self-medicate. So whether they had that as an issue before, it now becomes something else, and it then begins to perpetuate itself simply because some of our agencies that are there to support affordable, fair, safe housing are not willing to go the extra step to make sure that somebody is in place to help with the screening process, not to deny, but to say what other resources are available to make sure that they can be someplace that is going to aid in their recovery and aid in their health and wellness, versus sending them back into places that they can still barely afford, but are not going to be conducive to their overall health. And so a lot of it is just people doing what's necessary to keep their jobs, really, and not thinking more creatively about what else can we do, even if it's partnering with other agencies so that you're not adding more work, but you also know, let's pull in these folks for this particular case. But a lot of that is just the stigma, really, that's attached to folks with mental illness, and assuming that they're going to come in and tear up your stuff, or, you know, that they're not going to pay their bills on time. And that's such a small part of what happens in that community. And so if you are not helping to make sure that they have someplace safe, you really are contributing to the homeless population.
Yes, thank you, KaCey. And let me just take a moment and encourage our attendees and audience, if you have questions, please pose them in the Q&A link option at the bottom of your screen. Now, Afrika, KaCey just mentioned how this situation can lead to a cyclical behavioral pattern, and how there is an interconnection between homelessness and mental illness and substance abuse. Many people who are experiencing homelessness have experienced trauma as young people or have mental illness issues. They often self-medicate, and then the use of drugs may lead to addiction, loss of jobs, and homelessness. And also the criminal justice system may be implicated because when they're trying to survive on the street in Africa, you mentioned this earlier, they may do things like commit crimes or be suspected of committing crimes. What are some steps that practitioners and advocates can take to address this often intertwined and cyclical connection? I think you're on mute.
Yeah. So it's kind of what KaCey was saying earlier, is that we have to communicate. Oftentimes we are in these silos. And so as agencies, we don't know what is all out there. And to be able to assist our clients, we have to know what all is out there. And so as a community, understanding, so with Fulton DBHDD, we accept people at our sites regardless of their ability to pay. So they don't have to have insurance. And if you're feeling like, oh, okay, well, I don't have health insurance, well, I can't get therapy. Or I have health insurance, but I have this huge copay, so I can't get therapy. Well, that's not the case. And knowing that, over at Fulton County DBHDD, we accept all residents of Fulton County, regardless of their ability to pay. So there is services out there. And even with, within the community, I know that we have churches. So we, especially within the African American community, mental health has this stigma, so that we don't want to go out and seek help. So the community and just kind of encouraging more mental health fairs and normalizing the practice, because it's easier for us to go get a physical health checkup, but not a mental health checkup. So encouraging those sort of things. At church, they can refer them out to a community mental health agency so that they can address some of those issues that they may be having, and whether it's mental health or dealing with housing issues. And we know that with the homelessness preventative funds, it's easier to keep you housed than it is to get you rehoused. And so if it's, paying utility bills or covering that next month rent, we can manage those. Once we keep you housed, then it's easier to address additional mental health concerns than, once you become homeless, now I have to deal with finding housing, finding food, finding all of this, my basic needs. And so I'm not going to deal with my mental health crisis over here because I'm trying to figure out where to eat.
Right. That's interesting that you said that. I've never thought about that. So I've been to college fairs that were hosted by churches, or health fairs where you can get your blood pressure checked and get a glucose screening and things like that. But I don't think I've ever heard of a church hosting a mental health fair. And I think that would be a wonderful addition to many of our communities. So I'm glad that you mentioned that. You mentioned that Fulton County offer these services free of charge to those who are in need. How can someone who's watching this webinar access that treatment, Afrika?
They can definitely
those resources.
They can definitely go on our website, Fulton County Department of Behavioral Health and Developmental Disabilities. And give me 1 second, I'm gonna get the phone number for you.
Okay, sure. Now, KaCey, let's turn to you. Are there tools that we must rely on to fix the issues of homelessness and mental health and substance abuse that are outside of the political and policy-driven realm? Can communities, advocates, and grassroots activists play a role in changing some of these patterns?
Absolutely. I think the most recent example is the budget cuts that just happened in the Georgia Assembly, right? So the agency or the entity that makes financial decisions for where monetary resources are going to go for DBHDD and, for HUD and for all these other places was substantially cut. And so while it's not the most attractive thing, but calling whoever it is that you are, whoever your legislator is, and saying that, look, I may not deal with this personally, but it's really important that you're funding agencies that are helping with homelessness and mental illness. It's really important that we are putting more money into affordable housing because it really benefits all of us. And a lot of times what happens is we think because you're not dealing with it in your personal home, that what happens 6 doors down does not impact you, but it absolutely does. What happens 6 doors down impacts your property taxes, it impacts the police presence in your community, it impacts whether or not you're responded to in a timely fashion when you are calling for help or needing resources redirected in your district or your county. And so even though your house is okay, it doesn't mean that what's happening across the street or around the corner does not impact you either. But in addition to that, making sure that when you find resources that are helpful, that you are sharing them. Like Afrika said, especially in the Black community, our faith-based communities are kind of our go-to for everything. Even people who don't know what they believe, when they get in trouble, they find somebody's church, right? And so we have to get to a place where we are not feeling as though things are separate but equal, or separate and apart and separate and distinct, but we have to know where people are going and getting the information to where people are, and then also making sure there's a two-way communication and a two-way street with that. And I make this appeal: find organizations that are doing the work and donate to them. It is so simple. If you don't have the time, you don't want to call your legislator, that's not your thing, fine. $5, $10, I promise, if you do that even monthly, $5 a month, if 100 people did that, that is substantial for a nonprofit, even though it may not sound like it to you, to be able to make sure that at least 2 or 3 people are getting services that they need. And so stop thinking about it as something that's too big for you to make a difference in. Do what you can, but be consistent in it to make sure that folks have what they need to expand. I can think of tons of organizations off the top of my head that do phenomenal work, but they're in little tiny places in the metro Atlanta because they don't have the funding to be able to expand, to continue to do the good work elsewhere. And so a lot of times they're not sharing what they do because they don't have the bandwidth, and they don't have the bandwidth because people feel like their $5 isn't going to mean much, so I'm not even going to give the $5. And that's just a plug right there, because when it comes down to it, it takes money to do all these things that we're talking about. And if our government is not going to fund it, then as a community, we have to figure out how to do so.
Absolutely. And you make a wonderful point, KaCey. And I think now is the time, as we as a community and as a country and as people of color are now looking more closely at how we're directing our financial resources and what causes we want to support. That's a worthy cause right there, supporting mental health treatment and coverage in our own communities. That right there can address a number of different situations. So thank you for that. Afrika, I know you were going to get a resource that you could offer to help those who are in need by Fulton County.
Yes, so adult behavioral health services, you could call the number 404-665-8600. Again, for adult mental health services, that is 404-665-8600. And for child and adolescent services, and those services extend up to our emerging adult population, which we identify as 18 to 24. So child, adolescents, emerging adult, that would be 404-612-9339. Again, that number is 404-612-9339.
Thank you so much for that. Now, Afrika, states today spend about 30% less on mental health care than they did in 1955. Has the Georgia Housing Voucher Program that you know of, which provides rent assistance to those who have mental illness and who are chronically homeless, have they made progress when it comes to providing housing to members of the homeless population who have a mental health disorder?
So there we have housing vouchers, but then there's also permanent supportive housing. So that that key specialization is for those that have disabling conditions, whether it's mental health or physical health. And so with permanent supportive housing or housing vouchers, it goes back to developers and landlords. So with the housing vouchers, are landlords accepting those housing vouchers? So we can give out the housing vouchers, but if a landlord isn't accepting those housing vouchers, or if it takes forever to find one, or if that housing is located in an area where there's a food desert, or they lack access to resources, then it's going to be that much more difficult to not only to remain housed and get the resources that you need. So if there was mental health services or case management services, now I have to, take a bus 2 hours to get to, wherever my resources are. That's if the bus runs in that area. And so the permanent supportive housing, the unique thing that comes with permanent supportive housing is it also comes with a treatment aspect to it. So we have treatment teams that support those that are going into permanent supportive housing. And so it gives you that additional support to keep you housed once that you are housed, developing those skills that if you have been homeless for an extended period of time, learning how to remain housed, how to pay your bills on time, how to navigate community resources, how to grocery shop, just the basic things of how do I maintain my home. But we also have to get more developers who will reserve a portion of their units of these newly built developments to permanent supportive housing or accepting housing vouchers. In Atlanta is just really difficult to find affordable housing. So the issue comes in is who is controlling the housing. So the vouchers aren't really the problem, it's having access to the housing.
I see. Okay, thank you for clarifying that. KaCey, based on data from the Substance and Mental Health Services Administration and looking at the overall health of the homeless population, mental illness and substance abuse far outweigh the physical ailments that they experience. So treating the homeless population does not simply end with providing them shelter, right? So should they find a house tomorrow, that's not the end of treating them as a whole person. And it appears that a holistic approach should be applied so that the whole person could be treated. What would that holistic approach look like in your lens?
Yeah, I think a lot of what Afrika has already shared, making sure that you not only give them a place to sleep, but you're helping them find gainful and meaningful employment, but you're also maybe helping them learn how to budget. How do you spend your funds, especially if they're limited, in a way that's going to keep you from always living paycheck to paycheck, or if you are living paycheck to paycheck, you're not so stressed at the end of the month because you have a budget that accounts. Again, how do you shop if you're living in a food desert, right? How do you make those dollars stretch when you're going to spend much more going to fast food, even if you're making healthy choices, than going to the grocery store? But if you don't have a car and the grocery store is 10 miles away, then you're going to pick the McDonald's or the Burger King than the hassle of trying to get to the grocery store. So those holistic measures look like making sure that in your communities, you have everything that's needed for folks to be sustained. So as we think about walking cities, which Atlanta is not, right? When you think about walking cities, schools are walking distance, grocery stores are walking distance, banks are walking distance. Everything that you need to live, you can physically walk within 10 to 15 minutes of it to get what you need. That is not what we have here in Atlanta in all communities. And so it must start with the redesign of what our communities look like. But in the meantime, also making sure that we are putting into place easier ways for folks to access what they need. So many times when you're calling for services did you call this agency first? You call that agency, but nope, you have to go over here and talk to this agency first and get an approval or a letter from them. But then, nope, you got to go back to the first person that you called because they didn't give me a referral. And instead of just making the resource available, it then becomes this sharing of sorts of who's going to start where, because it then becomes a responsibility thing. So really holistic starts from a more macro level to make it easier to access the resources, even down to grocery stores, making it easier to get into housing, and then making it easier for people to stay in those housing units because they have meaningful, gainful employment where they can sustain themselves. But in addition to that, making sure that our cities and our counties and our governments and our communities are being very vocal and proactive about the resources that are available. A lot of times it's, oh, but you didn't ask. Well, I don't always know what question to ask, right? That's all of us. Anybody who tells me they always know what to ask in a situation that you've never been in, I'm gonna probably think you got a little pride issue, because nobody always knows. And if I don't know what question to ask, then I don't know that the resource is there, versus you saying, hey, I'm the holder of the resource, let me make sure people know that it's here, versus holding it and waiting for people to come get it, not even knowing that I exist. And so a lot of it also starts with those who have resource or access to it, doing a better job of letting the overall community know that, hey, I'm here and I'm ready to help.
Yes, so true. Afrika, you spoke earlier about there being a disconnect between landlords and the Georgia voucher program, and how often affordable housing can be a part of the challenge that is to be overcome with this issue. There's also a special problem that although discrimination against the disabled is illegal under the Federal Fair Housing Act law, discrimination against users of illicit drugs and abusers of alcohol is not illegal. So landlords can refuse to rent to people who have substance abuse issues. And housing programs can exclude them, and group homes and supporting housing can reject them. I think most would argue that demanding abstinence from drugs or alcohol before housing services are provided is probably asking too much of the mentally ill homeless. So how do we get around these issues in treating this homelessness population? Is it, again, that we need to talk to each other more, and that departments need to come together and communicate more to solve these issues?
So we do need to create more low barrier programs. And so with high barrier programs, we feel that if a person who's seeking help have this, and this, all of this in place, then they're more willing to, they're easier to work with, and they're more willing to be successful in this program. And then if I'm in a program that is backed by funding, then I'm looking toward my successes, because those numbers will increase. So if I have someone that already has, substance abuse issues, then that more than likely that person may end up being in my program longer and reduce my success rate. So we do need to have more low barrier programs, because when it comes to recovery, if you've done any recovery work, relapse is also part of recovery. There's also a step down process. And also we're asking people to completely drop their coping skill just to be a part of a program. And so we're not really giving them anything. We're saying we need for you to get rid of all of the coping skills, however maladaptive they are. We need to get you to get rid of all of your coping skills just to be a part of this program. Well, I don't know that your program is going to work. I've been over case managed. I've already had people come in and promise me that they're going to give me housing and food and all of this stuff, and it hasn't worked. but you want me to stop what I'm doing just to make it throughout the day. So making sure that we have low barrier programs in place, that we set up and practice a success rate. So if I have this small goal and I know I'm successful in meeting that goal, then I'm more likely to do another goal and then a bigger goal. And then, okay, I'm able to be housed stably for an extended period of time. Then it's easier for me to, one, learn other coping skills so that I can transition out those maladaptive coping.
Thank you for that. I think you made several points there, and I'm taking notes, and I hope other people are too, because you're right. You're asking a lot of that population, and so we need to be more sensitive to that. KaCey, are there ways in which the public who are outside of the medical profession can help with the issue of homelessness and mental health?
Yeah, it starts with changing your mindset, knowing that it's highly unlikely that they're going to harm you. A lot of times people don't even want to have conversation with someone who's homeless or someone who has a mental illness because they are afraid, whether it's an ideal perpetuated in the movies or in the media, that folks are going to be violent. If anything, it's more likely that they're going to be violent towards themselves than they are other people. That's one place to start. Another place to start is to have conversations. You'd be surprised. I always think of my friend Mark, who I think the founder of Love Beyond Walls has done some work with you all with the National Center for Civil and Human Rights. And Terrence gave me an opportunity to work with Mark. Mark was homeless. But when we had a conversation with Mark, what we found out was Mark held 2 master's degrees, that he ran a finance department of upwards of $5 million before he got laid off. He got laid off, and then his family unit fell apart because he wasn't able to bring the income in. Because contrary to what you believe, even if you're making 6 figures, you can live paycheck to paycheck, right? And so because he lost his income, he lost his family, he lost his house, but he didn't lose his mind. And people treated him as though there was something wrong with him. And had folks stopped to talk to him, he could have given you a strategy to change your entire business plan in 5 minutes. And what we did was help him get his license back. And he got a job that was hourly, and he found a rooming house. And now Mark is back being a manager, back on his way towards 6 figures, because he didn't lose his skill set. He just lost a place where he could shower and stay clean and wash his clothes and get rest, so that when he presented himself to the rest of the world, people would stop and take notice of him. And we're bypassing so many people simply because of what they look like or what they smell like, and not understanding that a lot of folks really are where they are, not because of bad decisions all of the time, but because life happened. And life can happen to all of us if we don't have certain safety nets available to us. So have conversation. There may be somebody that you can help in a very small way that makes a big difference to them. The other thing to do, again, I go back to find organizations that are doing the work and help to fund them so that they can continue going and getting people who are ready to do the hard work of getting back on their feet, that there are people available and resources available to help them with that. The other thing is that when you're advocating for yourself, advocate for others. If you're the person who's down at the city hall meetings, don't just talk about the stoplight at the end of your block, but also ask, what are you doing for homeless people? What are you doing for those with mental illness? Because again, even if it's not in your home, I promise you what is happening around you is going to meet you in your home at some point. So you ignoring it and you not speaking up about it really is impacting you more so than it's impacting somebody else. And then the last thing that I would suggest is to do more research versus, more than what you just see on news and on television. Really educate yourself on what mental illness is, because truth be told, more of us are probably experiencing a mental health breakdown more often than not than the person who is having a more challenging time bouncing back from it. And so I tell people all the time, we all have mental health, and it's either illness or we're on our way to wellness, but we all have moments where we're not handling life appropriately. And if we don't have the tools to get ourselves back on track, that can then spiral into something else. And so we're all not that far from experiencing the things that we say we don't want to be a part of. And in that, it's about educating yourself so that when you do encounter someone, you know how to be supportive. The last thing that I would say is we are, both through NAMI Georgia and through some other organizations, hosting mental health first aid courses. And so it's not necessarily about you administering help until someone else gets there, which is the point of it, but it's about educating yourself on what signs and symptoms are, how to better have conversations with folks, how to make sure that in your greatest intention, you are not offending somebody simply because you don't know what to say or how to ask a question. And sometimes just saying, I don't know what to say or what to ask goes a long way than you trying to figure it out. And so really it's about, if I had to sum all of that up, getting out of your own self, getting out of your own bubble, and realizing that there are very small things that we all can do. And when we all do them, they make a huge difference.
Absolutely. And I heard practicing empathy in there too, right, KaCey?
Absolutely. Mm-hmm.
All right. Well, we now want to turn to our audience to pose questions to this distinguished panel, KaCey Venning and Afrika Cotton. We already have one attendee who has asked, do you think we put housing first and then focus on mental illness, or the other way around? I ask because people are saying, hey, go get a job, and then we will help you find housing. So would either of you like to tackle that question, or both of you?
I can start. I do think that it needs to be housing first. And I'll use a very personal example. Have a family member who's constantly in transient, right? Always place to place, place to place. And my mother and my aunt are always very concerned about, well, where are they going next? And, you know, what's happening to them now? And I very simply told them to alleviate your stress and to help them, go find some place for them. If the family has the means, even if I have to chip in, let's pay the rent for them and all their utilities for 6 months, right? 6 months for you to get some skills, to help you find a job, to maybe get a check or two, to help you get a budget, to see if you can manage that on your own with some support. And then we begin to transition you into being able to facilitate on your own. But saying to that family member, go get a job and hold that job for 6 months before we help you, is not going to happen if they're always bouncing around from place to place based on what they can afford. Then the job that was walking distance is no longer, and the bus doesn't run over to that place. And so now they lost the job trying to find a roof over their head, where let's take care of the housing for them so that they're stable. Let them then go get the job, and then put parameters in place of how we begin to pull back the support as they are becoming more self-sufficient. But to tell someone, go get a job first and bring me 3 check stubs before I give you this apartment or this place to stay, it's rarely going to happen that way. And it's not sustainable, because people need that Maslow's hierarchy of need. They need to be able to feel safe, right? First, before they can then be freed up to do other things.
Yeah, and it's taking care of your basic needs. So as I stated before, if I'm worried about where I'm gonna place my head, where if I'm safe, where I'm gonna get something to eat, I'm not worried about trying to get a job. I'm trying to figure out when my next meal is, or where I'm gonna sleep tonight. And is wherever I'm gonna sleep, is it safe? And so I think when it comes to housing or offering help, the people who are offering help feels like the people who that are the recipient of that help is just gonna end up taking advantage of oh, if I give them a house, then, they're not going to want to pay the bills because I'm paying all the bills. But more often than not, people want to be able to take care of themselves. And so giving them the tools to be able to do that, then they can take care of their mental health needs. But making sure that, my basic needs are taken care of is paramount. That should take priority.
Thank you both. In 2018, the Atlanta Journal-Constitution reported that hospitals were discharging people with mental illness to extended stay motels and homeless shelters at greater numbers than it did in the previous year. How can we advocate for changes with this practice, especially as Afrika pointed out, there's a shortage of affordable housing, at least in Atlanta?
Yeah, I think it starts at the beginning of our conversation. Most people who are going to the emergency rooms and hospitals for mental health care is because they don't have access to resources in their community. So if we make resources in the community more affordable, more accessible, then you'll see a decline in the number of people who get to a place where they have no other choice but to go to the emergency room and be admitted because there was no other place for them to get any help and get any support. So it definitely goes back to increasing the number of resources that are made free, affordable, and accessible to people in their local community. As Erica so eloquently put, low barrier. Stop making it hard for people to get help. That will then drastically reduce the numbers of people that they see in hospitals for things that could have been taken care of with a treatment plan or with a care team in their local community. So it starts there. But then it also goes back to, we don't have affordable housing here in Atlanta. I am so amazed that when someone says affordable, they're still talking about $1,800, $1,900, $2,000, sometimes for a 1 and a 2 bedroom within the city limits of Atlanta. And I'm like, I don't know, unless you're a multimillionaire, that's not affordable housing, right? Now, some people can afford to pay it, but it doesn't mean that it is affordable. And so we need to really think through, as we are building the city, as we are building new apartments. I live in Washington Park, and I can go any direction, northwest, south, east, doesn't matter. And I can count 5 to 6 new buildings that are going up for condos, townhouses, apartments. But when I look, a 1-bedroom is starting at $2,200. There's no way that you can tell me that the West Side is supposed to be affordable when a 1-bedroom apartment is starting at $2,200. Right. And so for folks who are working a steady job, but hourly at $12, $13 an hour, there's no way that they can afford that. And so again, we get right back into this place of, because they have to continue to move over and over and over again, they're not focused on their mental health treatment, which puts them back into a cycle of having an episode, will push them back into a cycle of not getting the resources, will push them back into a cycle of being in the hospital because they have no place else to go, or purposely getting arrested so at least they have some place to spend the night, even if it's in jail.
Yeah.
Wow.
And then even having an eviction on your record makes it that much harder to be housed. And so, when we're talking about ways that landlords can discriminate, well, if I know that you're having trouble affording your rent, I can look and see how many times you've been evicted. So no, I don't want you to come live up here. And yeah, and families are doubling up because the rent is so high. So, and then of course they end up getting kicked out because not everybody is on the lease. And so people are really trying to find ways to survive within the city, but they're trying to remain in the city because this is where the resources are. Mm-hmm. And so, when you're looking for, affordable, that definition of whoever is defining affordable, the houses or the residents that people can afford on, $12 an hour are further and further outside of the city, which means that limits the amount of resources you're connected to or the accessibility to those resources.
Mm-hmm. Important point. We have a new question from an attendee. This attendee asks, how can we help new people with the passion to help people who are homeless? We see a lot of the old program that is not working, but they are still getting funding. So I think they're asking, how can we help a new generation of professionals and I guess lay people who want to help the homeless? How can we assist them and empower them?
Yeah, that's again about speaking up. I encourage people, somehow make it your business to attend a city council meeting, even if it's just one time for you to have that experience. And what you will find is that it's very cumbersome. And you may sometimes feel as though you're not heard. This is where it's also really important for you to develop a relationship with the person that you elected to represent you in your particular district, whether it's a county commissioner or a city council person, what have you. You should be communicating with them enough that they're at least familiar with your name, right? It's not always about a bad thing, it's not always about an issue, but open up lines of communication so that when you do have a passion area, you know that someone is going to at least be willing to listen to you, to advocate on your behalf. The other thing is to speak up in those organizations that you're a part of, whether it's church or faith-based, sorority, fraternity, school, PTA. I don't care what you're connected to. You can use that as an opportunity to say, hey, what are we doing for folks, be it adults or youth, depending on what organization you're connected to, related to mental health, related to mental illness. There's room for it at every level, regardless of whether you're in the field of behavioral health or not. Again, your school PTA, there are children in your child's school who are suffering from a diagnosis, or their parents are. That should be a priority. Our fraternities and our sororities, our civic organizations, these should be priorities, and we should be speaking up. Be that squeaky wheel within your network so that someone at least hears you long enough to really have a substantial conversation to see what you can do. Don't discount things that can happen one time if it can bring awareness. And for those who are really connected, find ways to really serve in organizations that are doing this work. But the biggest thing is, like, be that squeaky wheel. Start talking about it to the point where somebody stops and says, what do you want me to do about it, right? And then give your suggestions.
Right. I would also say, have those conversations. I know that sometimes it does seem like, okay, these organizations have been at it for years and years, and they keep getting funded, but the problem doesn't seem to go away. Well, have conversations with people who work in those organizations, who serves on the board in those organizations. And you often find that it's not simply the organization, but the policies that surround those organizations, or where the funding comes in, because with that funding, there's all these parameters that have to be put in place in order to receive housing or mental health services or things like that. So it's not just, okay, well, this agency isn't doing what I think they should be doing. Have conversations with them and see what the obstacles or those hurdles are. And then be either an advocate for those organizations, or speak to your representatives. Be that squeaky wheel. Okay, there's a huge void here. Why is there a huge void? Why, when we're looking at instances of homelessness, if someone is in jail 90 days, then they're no longer considered homeless, or in the hospital, then they're no longer considered homeless, right? And so now that has disrupted my my homelessness, and now I not considered homeless then, and now I have to kind of start over. Yep. Or if I stay at my mom's house or my aunt's house a week too long, then I'm no longer considered homeless. So of course there are agencies that have pros and cons, but all of it isn't about the agencies. We really have to start looking at the policies when we get out and we're speaking to our representatives, or even when we're voting, to educate ourselves on what are we voting for. The topics of a bill or a law can sound impressive. However, when we read the meat of it, we can see how many people are getting X'd out of those policies or of the funding simply because they may have a criminal record, or they may have an eviction notice, or they may have, a substance use history. So becoming more informed and having those conversations.
Wonderful tips. I would also like to ask both of you how COVID-19 has affected your targeted populations and your organization. So for Afrika, the Department of Behavioral Health and Developmental Disabilities, and for KaCey, NAMI Georgia, how has COVID-19 changed your work?
Well, we, of course, trying to make sure that we are keeping our staff safe, and also the population that we're serving safe. We have switched to telehealth, or we had to switch to telehealth. And so a number of our work was done virtually, either via the computer or either over the phone, until we were able to equip the buildings with making sure that people were safe, social distancing, making sure that there was temperature checks and hand sanitizer, because we have to protect the health of the population that we're serving, and also the staff as well. And so we have now started opening our centers back up. And so if you would like to go to one of our centers, you can. Those are accessible. But we did have to dial back on a number of our specialty programs, like our homeless engagement teams. We had to, pull them in. We also had reentry services over at the Fulton County Jail. We had to stop those, also because the jail is trying to protect the population that they're serving there. So a number of our specialty services we had to put on pause for a while, but our mental health services are still accessible.
Okay.
Yeah.
How about you, KaCey?
Yeah, we moved all of our support groups online. And so we asked for all of our affiliates and all of our community groups to halt any in-person support group meetings, and gave them ways to try to ensure fidelity and privacy as much as possible online. But we just realized that people interpret guidelines differently, and it's just safer as an organization to make sure that we put things in place to protect people as well, versus leaving it up to people's interpretations. And so it doesn't always work like we want it to, but right now we did not want to just halt everything that we were doing. And so we moved about 90% of our programming online, and what we could not move online, we just chose not to do at this time.
Awesome. Well, please join me in thanking this powerhouse panel we have. I think we are very privileged to have Afrika Cotton and KaCey Venning with us today. I want to thank both of you ladies for providing very valuable resources and tips, and helping to guide us and navigate these very important topics that we can use in our work and in our personal life. So I want to thank you from the bottom of my heart. And I want to thank you all for attending this very last Health and Human Rights webinar in this web series addressing mental health disparities. If you'd like to review any of our previous webinars in the series, please feel free to visit our website, 2020healthsummit.org, where you can access those webinars. And if you have been there for each of our 6 webinars, yay, you get a gold star. But we really appreciate you. We definitely wanted to try to touch on the disparities with respect to mental health, because while we understand that disparities exist in American culture through all of our institutions that we can name, we thought that more weight and more emphasis needed to be put on mental health disparities, especially with respect to marginalized populations. And so we thank you for joining us for this web series. And if you have any other questions, please visit our website. And we want to thank you for joining us today. And you can also find more resources on our website, 2020healthsummit.org. We hope that all of you remain well and have a blessed day. Thank you.